Hi, I'm David with the Florida Pain Network, where we connect those in pain with pain relievers throughout the state. And that includes pain management doctors, pain clinics, chiropractors, and physical therapy practices. Today the topic is epidural steroid injections. What are the risks and side effects? Well, first let me briefly discuss the benefits, because that's the best part, is that they are very effective. Studies have shown that since 1952 or so, when epidural steroid injections were first done, the benefits are between 75 and 90% get excellent pain relief. Recently there was a study 2 months ago in professional athletes showed that 89% were able to avoid surgery and get back to professional athletics with a disc herniation and undergoing epidural steroid injections. So the benefits are tremendous. They can either be done as a one-time or a series, and then multiple times per year if necessary. For instance, if you have spinal stenosis, which is a mechanical problem, it's not just going to go away, then you may need those a few times a year, to avoid surgery. So what are the risks? Well, it is a low-risk procedure. It is not a risk-free procedure. Okay, so you have to be cognizant of those risks, one of which is infection. The risk of infection is much less than 1%. It's probably 0.1%, so 1 in 1,000, but it happens. And it doesn't happen enough so that you need prophylactic antibiotics before the procedure, like a knee replacement would, but it happens, okay? So fever after the first night, or fever of the first night of an injection may be normal, but if it persists, and your doctor will have specific instructions on this, usually if it's over 101, past the first night, then you should contact your doctor and find out if maybe there is an infection, okay? Bleeding. Now, the needle is going in around the spinal cord. If there is some bleeding as a result of that, it can cause a problem, especially if you're on anti-clotting medications or anti-inflammatories. They can cause clotting issues, like aspirin. You should notify your doctor about that, and you're going to need to stop those medications a few days before the procedure. He or she will tell you how many days. Okay, oftentimes it's 5 to 7, but they'll tell you specifically their recommendation on that. So another risk is a dural puncture. The covering around the spinal cord is called the dural sac, D-U-R-A, and sometimes inadvertently the needle can go through that sac and cause what's called a dural puncture. Now, usually those just heal up within an hour or two and don't cause any issues. However, you can get some seepage, some leaking of the cerebrospinal fluid from the inside, and that can cause what's known as a spinal headache. And usually that bothers patients a lot when they're standing up and dissipates when they lay down. So if that's the case, you have a big time headache when you stand up, it goes away when you lay down or dissipates, you probably have a spinal headache. Notify your doctor about that. Sometimes it can be treated with bed rest for a while, drinking some caffeine to help alleviate the pain from the migraine or the headache that results from the spinal headache. So there's another risk. It doesn't happen too often, but it exists. Okay. Another one that's extremely unusual is nerve damage. So sometimes the pain doctor will inadvertently hit the nerve root that they're trying to put the steroid around, and that can cause some tingling and jumping of the leg. And oftentimes they just move the needle, inject the medication, and that goes away. It may take a few days though. Very, very rare, there's been reports of paralysis from an epidural injection. So what are the side effects of an epidural injection? Well, they usually come from the steroid medication, but the steroid works so well that it is the gold standard for an epidural injection. Because you have inflammation, which causes inflammation around the nerve root, which causes pain down the leg, if it's from a disc herniation in the low back. And the steroid is a huge anti-inflammatory and knocks out that inflammation, which is why it works so well for pain relief. And it can stick around for a few weeks to a few months, so it's just shown to be better than the other medications out there being used. So the side effects, you can have a temporary increase in blood sugar, you can have a temporary decrease in the immune system. Usually this stuff is just transient. You can have 1 or 2 nights of sleeplessness or affected sleep. First night, as usual, you might have a fever. That's typical, not necessarily indicative of infection. Also, not necessarily due to the steroid, you might have some facial flushing, some anxiety, and then some local pain where the needle went in when the numbing medicine wears off. So those are the main risks, but the benefits far outweigh them, okay? So the Florida Pain Network, as mentioned, connects patients in pain with pain clinics. We have a lot on the network. If you punch in your zip code, if you push, I need a pain doctor, put your zip code in, it'll show you the ones closest to you. It's geographically targeted. For instance, National Pain Institute has 7 locations in the Florida Pain Network, and they have board-certified doctors who do epidural steroid injections. They're experts in them, and they have 7 locations throughout the state. And there's multiple others in the network as well. Anyway, I'm David with the Florida Pain Network. Your pain stops here.